Hi everyone, I'm Dr. Ankur Ahuja. I'm an interventional cardiologist working at Fortis Hospital, Mohali. India is the coronary artery disease capital of the world. And the test most often used to diagnose coronary artery disease is coronary angiography. Today we would be discussing about coronary angiography in detail. Coronary angiography is a test where we are looking to detect blockages in the heart. That involves putting in dye in the heart and subsequently capturing X-rays to detect blockages. Once a person has symptoms of chest pain, breathlessness, palpitations, or even sometimes unconsciousness, one of the common causes is coronary artery disease. Once we have done preliminary tests and we are suspecting coronary artery disease, we want to confirm it. And the best way to confirm is by coronary angiography, and that is the gold standard test to diagnose this problem. Coronary angiography is a test which is done under local anesthesia. It involves either using the radial, that is through the wrist route, or a groin artery. Here we put in local anesthesia. Subsequently we put in a catheter, which is a hollow tube like structure which is taken right up to the heart. Radiopaque dye that contains iodine is subsequently injected into the coronary arteries, and running X-rays, which is called as cine, images are taken to detect any blockages. There are certain situations when coronary angiography becomes very important, almost necessary. The most common indication is heart attack. So if a person is getting chest pain and he or she is diagnosed to have heart attack or MI, ongoing chest pain, coronary angiography can immediately detect any occlusion which is the cause for the symptoms, and subsequently treatment can be done according to the findings. Any test has its own risk, be it angiography. Being an invasive test, it's not to be used injudiciously, because sometimes in complicated patients it can lead to infection, bleeding, arrhythmias. But one important complication where involves is contrast nephropathy, that is the dye which is used can lead to renal damage. So it is avoided in patients where alternative diagnosis has been established, or there are means to establish this diagnosis or alternative diagnosis, where we are looking to manage patient only medically and no intervention is warranted, or a patient who has renal dysfunction and the probability of disease diagnosis is little low.